Kidney. Kidneys are a pair of excretory organs lies on the posterior abdominal wall. Situation. It is situated on the posterior abdominal wall, one on either side of vertebral column, opposite to T12, L1, L2 and L3 vertebrae. The right kidney is situated slightly lower than the level of left kidney, since the liver occupies the right hypochondrium. Shape and measurements. Each kidney is bean shaped and it measures about 11 into 6 into 3 centimeters. That is, the length is about 11 centimeter, breadth is 6 centimeters and anteroposterior width is 3 centimeters. External features. Each kidney has two poles or ends known as superior or upper pole, inferior or lower pole. Two borders, lateral border and medial border. Two surfaces, anterior surface and posterior surface. Upper pole, it is thick, rounded and related to suprarenal gland. Lower pole, it is thin, pointed and lies 2.5 centimeter above the iliac crest. Iliac crest is nothing but the upper expanded end of the hip bone. Lateral border, it is convex. Medial border, it is concave. On the middle of the medial border, there is a slit, that is opening, known as hilum of kidney or renal hilum. The structures present at the renal hilum are, from before backwards, number 1, renal vein, number 2, renal artery, number 3, ureter. The other structures present at the hilum of kidney are sympathetic plexus surrounding the renal artery and lymphatics. Relations. The kidney has both anterior and posterior relations. Anterior relations. Anterior relations of right kidney includes, number 1, suprarenal area related to suprarenal gland, right suprarenal gland. Hepatic area related to inferior surface of liver. Duodenal area related to second part of duodenum. Colic area related to right colic flexure or hepatic flexure. Jejunal area related to coils of small intestine, that is jejunum. The anterior relations of left kidney are, number 1, suprarenal area related to left suprarenal gland, gastric area related to posterior surface of the stomach, pancreatic area related to body of pancreas, splenic area related to renal impression or renal area of the spleen, colic area related to left colic flexure or splenic flexure, and jejunal area related to coils of small intestine, that is the jejunum. The posterior relations of both the kidneys are same, except the right kidney is related to one bone and the left kidney is related to two bones. So the posterior relations of both the kidneys has muscles, nerves and bones. There are 4 muscles which forms the posterior relations of the kidney. Number 1, diaphragm. Number 2, psoas major. Number 3, quadratus lumborum. Number 4, transverse abdominis. 3 nerves comes to the posterior relations. Number 1, subcostal nerve. Number 2, iliohypogastric. Number 3, ilioinguinal. The subcostal nerve is accompanied by subcostal artery and subcostal vein. The right kidney is related to 12th rib, whereas the left kidney is related to 2 bones, 11th and 12th ribs. So these are the anterior and posterior relations of kidney. Capsule. The kidney is surrounded by a capsule. It consists of 2 layers. An inner fibrous connective tissue known as true capsule or renal capsule. An outer fibrous membrane known as false capsule or renal fascia. So there are 2 layers. Between these 2 layers there is a pad of fat surrounding the kidney, and it is known as perirenal or perinephric pad of fat. Okay. Outside the false capsule, that is the renal fascia, the kidney is surrounded by a pad of fat known as pararenal or paranephric pad of fat. So the kidney capsule has true capsule and false capsule. Between those 2 layers, the pad of fat present is known as perirenal pad of fat. Okay, the pad of fat surrounding the false capsule, that is present outside the false capsule, is known as pararenal pad of fat. Blood supply. The kidney is supplied by right and left renal arteries. The kidney is divided into 5 vascular segments based upon the distribution of branches from the renal arteries. The 5 arterial segments or vascular segments of the kidneys are apical, upper, middle, lower and posterior segments. So the renal artery on entering the hilum, that is near the hilum of kidney, divides into anterior and posterior division. The anterior division supplies the apical, upper, middle and lower segments of the kidney, whereas the posterior division supplies only the posterior segment of the kidney. This is the segmental vascular supply of the kidney. Venous drainage. Right and left renal vein, which in turn drains into inferior vena cava. Nerve supply. The kidney is supplied by both sympathetic and parasympathetic. Sympathetic is derived from T10 to L1 segments of spinal cord. Parasympathetic is by right and left vagal nerves. Clinical anatomy. Number 1, congenital anomalies of kidney. The most commonly occurring congenital anomalies of kidney are lobulated kidney, horseshoe-shaped kidney and renal agenesis. Lobulated kidney. It is due to persistence fetal lobulation in adult kidney. Horseshoe-shaped kidney. In this condition, the 2 lower poles of the kidney are united. Renal agenesis. It is a condition in which one or both the kidneys are absent. Renal calculi or renal stone. It is a condition in which there is aggregation of calcium, phosphate and other soluble salts, and it is more common in male than in female. Thank you.